Welcome to the Manual Handling module. Click on the Next button to start the module. In this module, you'll learn about what manual handling is, the legislation and the risks associated with it. You will learn about different types of manual handling equipment and how to move an object safely. This module also covers spinal awareness and postural awareness. Manual handling includes tasks where you need to lift, lower, push, pull, hold or carry something, such as an object, an animal or a person. See if you can match the correct words with the pictures, which show different types of manual handling. The Manual Handling Operations Regulations require manual handling to be avoided wherever possible. Sometimes this is not possible. In these cases, a risk assessment must be carried out and control measures set up to reduce the risk of injury.
It is your manager's responsibility to discuss with you correct procedures and any further training you may need regarding manual handling involved in your work. As an employee, it is your responsibility to follow any guidelines or information about safe working practices. You are also responsible for carrying out dynamic risk assessments for tasks, including assessing your own capabilities and the space surrounding you.
The spine is one of the main components of the skeleton and has a natural S-shaped curve. The spine serves vital roles, and it is essential we are aware of its importance and how to look after it. The spine provides central support for the body, the ability for movement to occur, and protection for the spinal cord. It should never be used for lifting. The spine has three main components, as you can see here in this diagram: the vertebrae, the intervertebral discs, and ligaments. As well as there being three main components to the spine, it is also divided into four regions: the lower back or lumbar region, the pelvis, including the sacrum and the coccyx, the chest or thoracic region, and the neck or cervical region. See if you can identify the regions on this diagram. Which region of the spine is most commonly injured? Adopting the correct posture when carrying out manual handling tasks can significantly reduce the amount of strain these kind of activities can put on our backs. Now take a look at the main principles you need to remember about good posture. Before you lift an item, the first questions you should ask are: Do you have to lift the item? Can you avoid moving it? You should avoid moving items if possible, but if you must, then there are a few more questions you should consider. We have identified that lifting heavy objects can easily cause injury, so now let's see how to do it properly. You will find that not only is this a more comfortable lifting position, but it will protect your spine from injury. Most back-related injuries that involve sprains, strains and lacerations are caused by poor manual handling techniques. Remember, it is your responsibility to lift safely and in your interest, so try to put all of these points into action every time you lift. There are several types of manual handling equipment that make lifting easier and safer. If possible, you should always try to use the appropriate equipment to lift loads. Examples of equipment are sack trucks, wheelbarrows, trolleys, roll cages, pallets and hoists. Make sure you know how to use these items properly. Ask your manager if you are unsure. Here is a summary of the topics we've discussed in this module. This module has provided you with some basic information about manual handling. If your job involves manual handling, your manager will discuss with you local procedures and any relevant training required to undertake manual handling tasks safely. What are the main functions of the spinal discs? Is this statement true or false? The first thing you should do before moving a heavy object is ensure you have a safe, secure hand grip. What positions should your arms and knees be in when you begin to lift?